variant of the vaccine that was discovered in South Africa and is circulating in several other countries. And we're following closely the evidence that suggests that it's more transmissible, but up to now, it doesn't seem to be more virulent. It's also very important to know how it might be preventable by vaccines or not. While it's always important to get access to vaccines, it's now more important than ever with this picture. What we are seeing now globally is not what we had hoped for. So we first, not me first, is the only way to end the pandemic. Vaccine hoarding by countries will only prolong the ordeal and delay recovery for Africa and also for the whole world. It would be deeply unjust if the most vulnerable Africans were forced to wait for vaccines while lower risk population subgroups in wealthier countries are made safe. Only through global solidarity will we end this pandemic. And the COVAX facility, which is co-led by CEPI, Gavi, and WHO, is laying the groundwork for equitable access to the vaccines. In Africa, COVAX is targeting phased delivery of 600 million doses by the end of 2021, and I'm sure we'll be hearing more from Tabani about this. This is based on 2 doses per person and is aimed to cover the initial 20% of the population in African countries. An initial 30 million doses are expected, and I say this with some caveats, to start arriving in countries by March. These are intended to prioritize healthcare workers and other high priority groups, and then expanding to cover additional vulnerable groups. But in the meantime, we're working very hard on preparing for the delivery and the use of these vaccines those vaccines that are most suited to our context and to rolling out strong delivery campaigns. It's often been said that acquiring vaccines is not enough. It's an important first step. Getting the vaccines into the arms of people, vaccinating people, is extremely important. We've assessed that regional readiness, looking at different areas to deploy the vaccines, is currently at about 42%. So this is a kind of composite estimate looking at different aspects of being prepared to deliver the vaccine. This is an improvement of the starting point of 33% about 2 months ago, but we still have quite a lot of work to do to reach the desired benchmark of 80%. So we in WHO, with our partners in UNICEF and others on the ground, are working with countries to develop their national delivery plans, to train healthcare workers, to strengthen health delivery capacities, to engage communities, and to address vaccine hesitancy, and to have a regional regulatory platform to support approval processes. So the step of approving the use of the vaccine in each and every country is very important, and we're supporting our member states to do that collectively. This will speed things up. At the global level, WHO is pushing to get data from vaccine manufacturers so that we can issue emergency use listings to guide national regulatory approvals. While the COVID-19 vaccines are a game changer, it will take at least until the end of this year and possibly longer to roll them out widely for African populations and communities. So it's very important that we continue to live the COVID-19 new normal. Everyone needs to continue with the personal preventive actions, wearing masks, physical distancing, hand hygiene, along with sustained strong public health capacities to find, test, isolate, and care for cases, and to trace and isolate their contacts. And WHO will continue to support countries in all these areas. So I look forward to our discussions today. And again, thank you so much for having joined us.
Indeed, we first, not me first. Thank you very much, Dr. Moeti. Now let's hear from Mr. Mohamed Fall, the UNICEF Regional Director for Eastern and Southern Africa. Over to you, Mr. Fall.
Thank you so much, Fiona. Let me start also by greeting all the journalists who have joined us in these important activities. Let me greet also all my colleagues and my sister, Dr. Moeti, who kindly invited me to join the press briefing. One point just to echo what Dr. Moeti mentioned in the beginning it's not me first, but it's we first. I think we have a moral obligation to look at the equity when we look at the vaccines, the access to vaccines, and not leaving anyone behind. But it is also important that we understand that, as we have been saying from the onset of this pandemic, no one is safe until everyone is safe. Moving and continuing the global engagement, continuing to promote the solidarity, continuing to promote multilateralism will be extremely important step before we get rid of this pandemic. And I think that's why I'm happy that today we are joined by Gavi, we are joined by WHO and UNICEF lending its voice also to this initiative. And when we look at also how are we going to support African countries, knowing also that vaccines and immunization is not new to the continent. I could say that even the continent, in many regards, is much better prepared than any other part of the world to engage in this important undertaking. Back to you, Fiona.
Thank you very much, Mr. Fall. And to our final speaker, Mr. Thabani Mafosa, the Managing Director, Country Programs, Gavi, the Vaccine Alliance. You have the floor.
Thank you very much, and a Happy New Year to all of you. Thank you, Dr. Moeti, for the invitation to speak today. Indeed, it has been a long 2020, and so when we look at 2021, I think the spirit is that while the night has been long, dawn is coming. And when we think about the fact that vaccines have started to be delivered, we are encouraged that indeed they will be delivered for Africa soon enough. The sense of urgency for Africa not being left behind is an overwhelming burden that all of us carry on a daily basis. And we very much remember the period of HIV and AIDS when Africa was left behind. And this time, I think the perspective is that never again will Africa need to be left behind too far. I must also take this opportunity to say that Dr. Moeti spoke about the COVAX facility that is co-led by WHO, CEPI and Gavi. This facility has only really been fully functional for 3 months. And the progress that we have made up to this point is remarkable. This has been achieved through our joint partnership at a global level for introducing what is a truly global solution for equitable access. But it has also been achieved with countries making their commitment and making sure that we use the ability for a bargaining and a buying power of a collective. Our goal is to deliver 2 billion doses of safe and effective vaccines in 2021, including 1.3 billion to 92 lower and middle income countries, which we call the Gavi COVAX Advanced Market Commitment countries. And this is to cover the first 20% as we support Africa to move towards the 60%. The good thing about the COVAX facility is that it is just the beginning, but it is a program that runs multiple years. We are not yet where we want to be, but I'm happy to say we are on track. Globally, we have secured access to 2 billion doses, as I've said. We have raised $6 billion to fund procurement, readiness, and delivery of doses. If we are successful in our fundraising, we could have access to even more doses, bringing the total available to probably 1.785 billion doses for AMC countries, or 27% of the population. This may not happen overnight, but as much as we wish for it to do. But as Dr. Moeti also pointed out, the readiness by countries is something that we have invested in. We do not want to have an excuse when the vaccines arrive for countries not to be able to roll out. So we see this as a challenge, but one that is not insurmountable if we work together. And in the meantime, it is important that we work together to manage both misinformation and to encourage the right behaviors for making sure that we fight COVID. I'll return back to you, moderator. Thank you.
Thank you very much, Mr. Maposo. Quite poetic right there, though the night may be long. Dawn is right here. Now that we've heard from our panelists, it's your turn to ask questions, our journalists. And to do this, please remember to either raise your hand in the chat function or use the question and answer function in the Zoom application. And also kindly remember that we need to provide a name and the news organization you represent in the Q&A function to be identified as a reporter in the chat function. We are also joined in the studio by Dr. Richard Mihigo, the WHO Program Area Manager for Immunization and Vaccine Preventable Diseases, who will also be answering your questions. To start with, I'll start with Sheligan Peterson from the Namibian. Please go ahead, go live with your question. Peterson, you have the floor.
You may need to unmute yourself.
Okay, so I'll go ahead and read the question from Sheligan from the Namibian. How many African countries have confirmed that the South African variant is actually there? And can you please name them? And this I will direct to you, Dr. Moeti.
Okay, thank you for that question. I mean, so far we know that Botswana, Zambia, and the Gambia have confirmed the presence of this new variant that was initially discovered in South Africa. We are, of course, aware that with the movement of people, and in fact, this virus has also been found outside of South Africa in other places. It may well be that the virus is circulating in other countries in the sub-region and even further along. So what we are doing as WHO is to have worked with a number of laboratories in the region that have the capacity for this gene sequencing. And we have offered the other countries, we've been in touch with the ministries to offer them to ship specimens initially to these laboratories for this quick establishment of whether this virus is circulating or not, while we work with them to establish the capacity to carry out this gene sequencing, which will become increasingly an important part of the surveillance for the virus.
Thank you, Dr. Moeti. So I'll have another question still from the Namibian. Can you, and I'll direct this to Mr. Fall at UNICEF. Can you kindly tell us how COVID-19 has been affecting pregnant women and mothers with newborn babies, and how many have died in Africa and specifically South African as a result of COVID-19?
Thank you very much. As I say, the pandemic has taken a big toll, and a big toll on all the segment of the population, but mostly on children and on pregnant women. On children, you all have seen the way the school disruption has been impacted on the continuity of learning in a context where we were already having a learning crisis. But you have seen also how some other hardly fought game has been challenged. If I take the routine immunization for children, I take the treatment of malnutrition, or I take access to IRV for prevention of HIV. All these aspects in which we have made progress in the past decade has been threatened given the fact that the access to health services has been limited. And I think for antenatal care also, we have seen the same phenomenon. And it's not only in terms of survival, it is also in terms of mental stress. It's also in terms of mental health. It's also in terms of further exposure to abuse, further exposure to physical and emotional violence, as we have recorded. We have seen now in terms of mortality an increase in the region, mainly in 2-3 countries where we have seen much bigger increase of over 43,000 deaths just in the region. I'm covering the 21 countries of Eastern and Southern Africa. Of course, the biggest burden being in South Africa. We have seen also how the disease has impacted in terms of survival and stress on the health workers. And we know that to have a continuity of care, to have a continuity of health services, you need also the health workers in their position. You need continuing health services to be provided to pregnant women, to be provided to mothers of young children, to be provided to children in all the areas that I mentioned earlier, which are immunization, treatment of malnutrition, treatment of all the leading cause of child death in the region. We don't have all an exhaustive statistic on the impact on those aspects, but it is evident that everything that is related to care, to survival and to protection of children has been shaken and has been impacted badly in the past 9 to 10 months. Now, seeing the new surge, seeing the current situation we are in the new year, I don't think that threat has gone. That's why moving toward the vaccines, we need also, as Dr. Moeti said, to keep the precautionary measure and make sure that we are still in this situation. Over to you, After.
Thank you very much, Mr. Fall. And now we go to a question from Jean Richard from Radio France International. And this goes to you, Mr. Maphosa. How many countries in Africa want to produce vaccines themselves? Which vaccine and for how many doses produced per month? To you, Mr. Maphosa.
Thank you very much. I think that this is a long-standing question in terms of production of vaccines in Africa. Dr. Moeti would actually be well placed to respond to some of the conversations that are happening on vaccine production in general. But maybe let me speak in specific terms. We are aware that Johnson & Johnson will be producing vaccines. I'm not sure of the volumes at this stage, but they will be producing from South Africa for the global supply, for part of their global contribution.
Okay, thank you, Dr. Moeti. Do you have an extra comment to add to this?
Yes, thank you very much. No, I do not have much more specific information to add. I mean, I do agree very much with Mr. Maphosa that question of moving towards regional, continental production of vaccines in general has been discussed in African countries very much for quite a while. There's been, I think, progress in terms of the establishment formally now of the African Medicines Agency, which is going to play an important role in supporting this, including the regulatory side of things. We do have some countries in North Africa that are able to produce some vaccines, but as far as I know, the only potential for production of this COVID-19 vaccine now is what was mentioned by Mr. Maphosa. What I hope coming out of this is that some of these discussions that have arisen in the context of this emergency of a pandemic will be sustained so that investment is made, the partnerships between the governments and the private sector and investors are made. And the next time something like this happens, we do have the capacity and the possibility for more local production of these products, which are so important, both for universal health coverage and in terms of pandemics and outbreaks.
All right, so we have another question from RFI from Jean Richard, and I'll ask this to you, Dr. Mihigo. So the question is there a possibility to do a quick change to the RNA vaccines to adapt them to the variant in South Africa and deploy the vaccine where this variant is found?
Yes, thank you very much, Fiona, and for the journalists from RFE. Before maybe elaborating on the change of the current vaccine, I think early indications are clearly showing that the existing vaccine will also be effective against some of these new variants. I think what is more important for the moment, as has been highlighted by Dr. Moeti, I think is to strengthen the capacity of countries to be able, as part of the surveillance, to detect any new variants that may arise. And if that surveillance is showing that some of these emerging new variants cannot be covered by the existing vaccine, the platform using the messenger RNA vaccine could, as the journalist said, potentially be scaled up to cover existing new strains. But for the moment, I think the message I would like to convey is that so far we have no evidence that the current vaccine cannot be covered by the existing vaccine. Over.
All right, so next I'll go live to you, Paul Adepjo with the Lancet. Kindly go ahead with your question. Remember to unmute your microphone.
Thank you very much. I have a question on the latest announcement of the US government rejoining the WHO and its participation in COVAX. So I want to ask, what is the implication of this announcement for Africa? And what is the latest regarding expanding access to oxygen to reduce COVID-19 deaths in African countries? Thank you.
Dr. Moeti?
Yes, thank you very much. I was actually one of the people connected to the WHO Executive Board session that is currently going on virtually when Dr. Fauci joined this morning and announced the decision taken by President Biden that the United States is going to rejoin WHO, and he elaborated on several ways in which they are going to re-engage in global health, in multilateral systems for global health. I think this is a very significant development. First of all, the United States is WHO's biggest donor, so the potential impact on the financing of WHO and therefore our work was actually extremely significant after the decision was taken to withdraw from WHO. And then secondly, as we've said many times, the importance of this member state, which has a very extensive capacity in public health, in global health, in various institutions that have been working in the multilateral sphere with WHO, with other partners, has been extremely important. So it's important not only for the funding, but also for the engagement of all the institutions, the experts that work in various WHO advisory groups, expert groups, and also work with us as we work with other member states. For the African region, I can say this is very important because the US has been one of the biggest partners of supporting some major health development actions in Africa. And if we are working with them as a member state of WHO, I believe it facilitates even this bilateral support. Their joining COVAX is also very important because, again, it's a signal of a wealthy nation following that principle of equity and global solidarity and contributing in various ways, including financially, to support other countries to have access to these important tools. So for WHO and for global health, I would say this is indeed very important and very significant development.
Thank you very much, Dr. Moeti. We have a question from Alicia Mihami for Allo Docteur Africa. It's in French, but I'll ask it in English because I would like you, Mr. Maposta, to answer this question. How do you choose the vaccines that will be distributed via the COVAX?
Thank you very much for that question. The COVAX looks at a broad set of vaccines, and the intention is to understand that there will be attrition. We will lose some vaccines along the way, and so we have got to make that pool as broad as is possible. But some of the other things that obviously are important, finally, when vaccines get to come out to the public, are efficacy, safety of vaccines, ease of handling, affordability. So those are some of the parameters that we look at. In the context of Africa, we have, as the Vaccine Alliance, invested in a lot of cold chain. And so the question is, can we actually bring vaccines that can leverage the infrastructure that already exists, but also working with countries. A specific example here would be the countries that have had Ebola, DRC, and other countries that can actually also handle the ultra cold chain, because they have handled the same for Ebola as well. So it's a broad set of vaccines that in dialogue with countries, countries guide us in terms of what their preference is for their population. But we want to make sure that we broaden the basket so that there is choice. As we know, that supply is always, or was always, going to be constrained. Having a number of choices would help us to actually ramp up faster.
Thank you very much. So I would like to go live now to Dayo Adesulu from Nigeria. Kindly ask your question. Okay, I'll read out your question, Dayo, and this question is directed to you, Mr. Fall. In Nigeria, the most affected by the coronavirus are the older people. There are little or no cases of affection among children. Does that suggest a high immunity rate among the children?
Thank you very much. I'm always happy when I hear the children's issues brought up in this kind of conversation. Probably on the level of immunity and the scientific dimension, I will leave it with my colleagues from WHO. But what I wanted to just say is that because of the vulnerability of the elderly, I think when we discuss the issue of prioritization, they will put among the priority group together, of course, with the frontline workers, and those frontline workers being health workers at first. This is also something we have widely used and discussed when it came to the issue of school opening. At some point, we say that yes, children could be affected like the other segment of the population. But if you put on a scale the damage that the school disruption was provoking among children compared to the public health impact, the public health impact was minimum, and the overweight was coming from the damage that the children were facing, both in terms of losing opportunity of learning, but at the same time also some of the issues that I referred to earlier in terms of mental health and in terms of further exposure to abuse. One point maybe I wanted to add in relation to children is that because of the national immunization program that has been rolled out for a decade, and to which I speak to when I was saying that Africa is used to immunization, and probably we could be even better prepared than the rest of the world to engage in this massive undertaking. It is in regard to the immunization program for children. How it saved lives in the Pacific. Recently in the continent, we celebrate the Africa-free poliovirus in the continent. There are so many achievements with regard to immunization of children, and that makes me confident that those experience and those lessons that we have learned can be stock from which we can take and make sure that when we get into this COVAX rollout, we will get it right in the African continent. Maybe just one word to say also and remind the UNICEF work in this together with the partner, but also that the undertaking, we are already for children procuring over 2 billion doses of vaccines per year. And I think with COVAX, we will be able also to step up our effort. But we know also it's not only a matter of procurement, but it is a matter also helping government to have the right cold chain, to have the right infrastructure for distributing the vaccines until it reaches the arm of the beneficiaries as Dr. Moiti was saying earlier. It takes also all the infrastructure that is around managing the syringes that you need for the vaccination, but also how to dispose those. And I think from the children's related program, we have so much learning as UNICEF and as global partners like Gavi, like WHO, that I'm really confident that once we start rolling out this program in the continent, it will be successful. Thank you.
Thank you very much. Now that we have a question from Anuradha Shepard from Times Aerospace UK and Aeropolimag, a French one. I would like to ask a question, and this is for you, Dr. Moeti, on the necessity of having a health or sanitary passport recognized by international health organizations like WHO and the airline, airport and aerospace associations like SCI World, IATA, ICAO, to help these harshly impacted sectors to restart sustainably and to give confidence to passengers?
Okay, that's a very interesting and important question in the context of the, if you like, post-lockdown push for people to be able to move and travel internationally. And these are matters that are being discussed between neighboring countries, among groups of countries in the same sub-regions, and also with WHO and IATA and ICAO being involved. I mean, what is happening now is that many countries are requiring people be tested as they leave to go and enter into the country, and there are differing protocols for requiring that people should come and be tested when they arrive. However, I would think that in most cases now, when you're going to travel internationally, you need to have a negative test. Whether this will go to the extent of requiring a health passport or not is something that will need to be considered. I mean, we need to understand also the duration of the immunity that is conferred by this by either the vaccination, and which is something that we don't know yet, and also if you have been tested and have a negative test, you are negative for how long. I think all of this is something that needs to be studied, to be monitored for a type of vaccine like this one. For now, in terms of the long term, we only have the requirement of yellow fever vaccine in many countries, which we know confers lifelong immunity. What we are encouraging, though, is that we can use technology to make some of these protocols more efficient and also more reliable. There is a lot of discussion about fake certificates of being negative for COVID-19, and we believe, and we're talking to governments and also to sub-regional organizations, that if all of this is, if you like, put into technology, then it's possible for reliable results to be sent electronically wherever they need to be seen, to avoid people carrying a piece of paper, which may be a fake piece of paper, which has been a problem up to now. But certainly there's something that will need to be considered as we are really pushing for opening up of economies, people being able to move around internationally as the vaccines are being rolled out.
All right, let's continue now. We go live to Falila Badamasi, I'm sorry if I pronounce your name wrong, from France Info Afrique. Kindly go live with your question.
Okay. Do you hear me?
Yes, we do.
Yes. Hello, everybody. I will ask my question in French.
Please go ahead.
Okay. It's about the... we read, j'ai lu récemment dans Reuters que les vaccins seraient disponibles pour les pays africains entre 3 et 10 $, selon un document que s'est procuré l'agence britannique auprès de l'Union africaine. Il semble que les pays africains vont préférer un vaccin qui est moins cher, celui d'AstraZeneca, qui serait donc à 3 $. Et on imagine aussi que du fait de la facilité de conservation du vaccin et du fait qu'il a été testé en Afrique du Sud, il aura peut-être la préférence des pays africains et peut-être du Bureau Afrique pour l'OMS. Je voulais juste savoir si vous pensez éventuellement vous concentrer sur ce vaccin pour les pays africains.
Okay, merci beaucoup, Falila. I'll give that to you, Dr. Mihigo.
Oui, merci beaucoup, Madame Falina, pour la question. Je pense que le coût relatif des vaccins que vous avez cité tout à l'heure, entre 3 et 10 dollars, a été, c'est vrai, annoncé par nos collègues de Africa CDC, notamment sur le nouveau supply portal qui vient d'être ouvert pour les doses qui avaient été annoncées par Africa CDC. Cependant, il est important de souligner ici que le coût, c'est vrai, est un facteur très, très important dans la politique d'acquisition des vaccins, mais il est également extrêmement important de regarder d'autres paramètres, tels que l'a souligné notre collègue Tabani Maposa, en termes de sécurité et d'efficience des vaccins. Il est important que nous ne puissions pas seulement penser à un seul candidat vaccin, parce que nous savons que pour le moment, bien que très attractif en termes de coûts, en termes de possibilités de stockage au niveau de la chaîne de froid, c'est vrai que le vaccin produit par AstraZeneca présente des particularités assez intéressantes pour les programmes nationaux de vaccination. Mais il est également important que nous puissions rester ouverts sur les autres candidats vaccins qui pourraient à terme également non seulement remplir presque les mêmes conditions, mais éventuellement être également à un coût abordable. Donc, je crois qu'en définitive, ce qui est le plus important, c'est de voir les types de produits qui pourraient être facilement introduits dans les pays sans pour autant perturber de manière substantielle le programme élargi de vaccination existant, mais également des produits qui peuvent être sur le long terme supportés par les budgets nationaux.
Thank you very much, Dr. Mihigo. I would want to hear a comment from Mr. Maposa on the same. Mr. Maposa, Falila's question was, according to Reuters, which relies on a document from the African Union, that different vaccines will be available between $3 and $10, the cheapest of them being from AstraZeneca. It is easy to imagine that the cheapest is what Africa will go for. Can we then imagine that African countries and WHO will focus on this vaccine, which has conservation advantages and is the only one that has been tested in Africa?
Thank you very much. I think Dr. Mihigo really responded to that question comprehensively. But if I were to add anything to emphasize, we cannot afford to have Africa waiting on account of price. If there is a vaccine and it is accessible and it can get to Africa, we need to get it to Africa sooner because the image of the North vaccinating and Africa being left behind is hurting all of us. We want to make sure that life is prioritized above price, but at the same time, we need to think about the long term. It's a balancing act that we are playing with here. The long term goal is to get something that makes sense for Africa, but in the short term, our main goal is to make sure that Africa gets vaccines at the earliest possible.
Thank you very much. The next is a question from Maggie Fick of Reuters to Dr. Moeti. Today, the Africa CDC said Africa's coronavirus case fatality rate stands at 2.5%, higher than the global level of 2.2%, a trend that is alarming experts. Please, does Dr. Moeti have a comment on why the case fatality rate is increasing on the continent?
Yes, thank you. Thank you for that comment. I think looking back on the case fatality rate on the African continent, quite a few months ago, it was averaging around 2 2.1% and was lower on average than several other regions. It has gone up, I believe, to about 2.5%. And of course, this is an average. It does not mean that this is happening in all countries. What we are seeing is some of the countries which are most severely affected, that are affected by the second wave. So a very large number of cases, and to some extent, challenges in the health system in terms of being able to provide appropriate care, where the fatality rate might be going up. This is the case, I believe, in South Africa. It's also the case in a few other countries, the Central African Republic and others. But on average, we do not believe that the case fatality rate in Africa is so much worse than in other regions. I think we always need to continue, even as we look at a vaccine, to look at the essential care, the quality of the care that is being provided, addressing the many clinical manifestations of this illness, making sure that there is sufficient oxygen. This is starting to be a challenge in some cases, and making sure also that people know and access treatment in time. So I believe that we need to disaggregate this data and make sure that in those countries where the case fatality rate may be increased, the quality of care, access to care on time is sufficient, and we need to continue to learn and to modify the platform of treatment based on the many different clinical manifestations of this disease, about which we are continuing to learn every day.
All right, and I have the next question for you, Mr. Fall. From Martin Amrein, NZZM Sonntag in Switzerland. How can African countries use the experience from other pandemics to handle the COVID-19 pandemic? And which countries do an especially good job in handling the COVID-19 pandemic, in your view?
Thank you very much. I think it's a good question. I'm not sure that I'm in a position to rank for the moment, as they have responded to the crisis. We have seen countries in the beginning that have responded very well, and with a limited number of cases and a very controlled transmission in limited clusters. But soon after that, we saw a new spike or surge in the number of cases. What I can say is that what helped, I think, the continent, and we did not highlight it very much also and enough, is that Africa throughout its history has been struggling with outbreaks, with diseases, the recent one being Ebola in West Africa a few years back, but recently also in different parts of DRC. And we have seen how, with the support of WHO, support of all the partners, government managed to step up their effort to control and address properly those diseases. That's what I referred to earlier also when I talked to vaccine preventable diseases. Have been a major killer of children a few decades back, and on which we have experienced and gone through several major gains. And I think these are the elements that, for me, prepare Africa to respond to the COVID. Governments, communities, people are confronted with several diseases that they used to go through, or they used to address, mobilizing different segments of society. And I think that's really what is the stake today when it comes to COVID. What kind of lesson can we take from the previous fight of outbreak to bring them into this context? And that's why earlier also I was saying humanization is something we are used to in this part of the world. All the challenge that goes with it, whether it is managing cold chain. Recently, I think between 2017 and 2020, we counted that over 47,000 refrigerators, including those that are functioning with solar power, was distributed across a number of countries in this region. We know also how to mobilize community, religious leaders, civil society to engage in addressing rumors that are around vaccines or hesitancy around vaccines. I work in Nigeria, and I know what it took to roll out the polio program that led us to this great success that I referred to earlier. Those are elements, and also I have referred to the recent fight against Ebola in a number of countries in West Africa, but also in DRC more recently. Those are elements that I truly believe have prepared the continent for rising up to the challenge that we are facing with the rollout of COVAX. And also this long and established partnership through Gavi, which facilitate easier access to vaccines for countries that are low income, the expertise of WHO, UNICEF know-how and experience in procuring and distributing vaccines to the last mile. All of this together, I think, put us in a position where I'm really optimistic that the rollout, despite the importance undertaking it constitutes, would be something that Africa will go through as we have done for other outbreaks. Over to you.
Indeed, that's quite reassuring, Mr. Fall. So the next one goes to you, Mr. Maposa, and it's from Amadou Kokaba from Santé de Servant 4 Info. Is there a system defined by WHO to rank African countries in terms of need for COVID vaccine? And if so, what are the priority countries?
Thank you very much. I think that all countries at this particular point, the allocation of COVID vaccine globally has not been based on epidemiology as a driver, but it has been based on this being a pandemic, where if one part is affected, all of us are affected. And so we are looking at Africa in a holistic manner. Yeah, I think that is the spirit of looking at it, that we should not be leaving any islands because, as Dr. Moeti spoke, the new variant that we see, if we can imagine that it was different and it was the vaccines were not effective to it. Fortunately, at this stage, it looks like they may be, but if they were not effective to it and they came from a country that we deemed as not a priority, we will all be back into another pandemic. So we need to think as a global community as one and not in silos at all.
Okay, thank you. So the next one is from Badr Kadis from Allo Docteur, pour vous, Docteur Mihigo. Le directeur général de l'OMS avait laissé entendre que le vaccin à lui seul ne suffirait pas vaincre le coronavirus. Quelle est donc la solution pour vaincre cette pandémie? Les gestes barrières vont-ils devenir une norme?
Merci beaucoup pour la question. Je pense que cela a été dit à plusieurs reprises. Il est vrai que le vaccin, la vaccination aura un rôle extrêmement important à jouer pour contrôler cette pandémie. Mais comme ça a été discuté depuis le début de ce webinaire, nous savons que nous n'aurons pas suffisamment de vaccins à temps pour que tout le monde soit protégé. Ce qui fait que les mesures qui ont été préconisées depuis le début de cette pandémie et qui ont été extrêmement efficaces pour contrôler la transmission de la maladie, notamment le port du masque et le port du masque correctement, la distanciation sociale, les mesures d'hygiène telles que nous ont été vulgarisées par l'OMS, ces mesures restent d'actualité pour le moment. Et nous pensons que ces mesures mises en place de manière efficiente, combinées avec une vaccination, pourront effectivement nous aider à contrôler de manière, je dirais, sur le long terme la pandémie. Mais tant que nous n'aurons pas encore suffisamment vacciné les gens, il est important de continuer à mettre en œuvre ces différentes mesures qui ont prouvé par ailleurs leur efficacité au début de cette pandémie.
Merci beaucoup, Dr. Mihigo. And this next one is for Dr. Moeti and Mr. Tabani. So it's from Sarah Javing with Devex. In an African CDC press conference today, it was said that countries can start to quickly roll out the Pfizer vaccine in urban centers once they become available by buying a handful of deep freezers for each city. Do you agree that African nations could quickly roll out the Pfizer vaccine in urban areas? And how widespread do you think the Pfizer vaccine will be used for the continent? How expensive is each dose of the Pfizer vaccine? I'll start with you, Dr. Moeti.
Okay, thank you. I think what was said is very much in the spirit of what my fellow panelists have already said, that it's important to take every opportunity to use every vaccine where it is feasible and where that vaccine is available to start the process. And with the idea that we will need most probably to use a combination of vaccines in different circumstances where they might be more feasibly delivered. So I think particularly in urban areas where the requirements of the cold chain or the so-called ultra cold chain might be possible to fulfill, more feasible than it would be in rural areas, certainly this Pfizer vaccine could be used. At the moment, there is a discussion going on at the global level with some of the wealthier countries to see those that have reserved additional or extra quantities of this vaccine, if they could start to donate some of their quantities, their share of the vaccine, to lower income countries. This might well be the occasion then to start the process of planning for the cold chain, for example.
Thank you, Mr. Tabani.
Sorry?
I think Dr. Moeti was still speaking. Dr. Moeti, back to you.
Okay. Yeah, so I mean, I think Tabani might well add to this, but I think we must use every opportunity. Clearly, it'll be more feasibly used in urban areas, and we need to look at every opportunity to look whatever vaccine. Tabani, you might comment on the pricing issue. I'm not aware of that detail. Otherwise, Richard might provide that information.
I see that Richard says he's ready to talk on the price. I think what I would say here is that, yeah, Dr. Moeti has articulated it. It is important for us to start moving and to start doing something. But while we do the urban centers, we also need to continue to think about equity issues, even within a country, where we don't leave a long time period between when the urban population is served and the rural populations are served. So I think the equity agenda must not be forgotten in that process, but we will need to start moving wherever it is possible to move.
Okay, thank you very much. As we do wind up our show for today, thank you very much to our dear journalists for listening in to us and for all your questions. We are coming to the end. Now let's turn to our panelists to hear any final messages. A minute for you each, and I'll start with you, Mr. Fall from UNICEF.
Thank you so much. Thank you so much, Fiona. Thank you so much to all the colleagues for this vibrant panel discussion. Thanks to the journalists for your question. Just a few key messages. I know COVID is a pandemic. It has taken a toll on everyone, but I always remind that the toll that it has taken on children need always to be kept in mind. Because it's not only the physical aspect of the impact, it's also the threat on some of the gain we have on child survival and development. It is also moving forward the socio-economic impact it has and how it can affect children. I just wanted maybe to highlight also the notion of equity and solidarity we started with. It's a pandemic, and no one is safe until all of us are safe. And there is no point of thinking that if you cover or you put some people on a safe conditions and leave others behind, you are going to address these issues. Lastly, an optimistic note also building on experience gain in terms of humanization program across the continent, in terms of partnership which have created so many facilities that make it easier for low-income countries to access to commodities and goods like vaccines. Building on those experiences, Africa can also, in the current context of the rollout of the COVAX, make the difference. And that's really notion of hope, and that notion, that optimistic tone, I wanted to end with on this press briefing. Back to you, Fiona.
Thank you very much, Mr. Fall, and it was very good having you on today's press briefing. And to you now, Mr. Maposa from Gavi.
Thank you very much. And I always love to use this opportunity to put a plug to our colleagues, the journalists. Thank you for your time here today, for listening and engaging us, but also thank you to WHO for inviting us. And the plug that I normally put is we have a big job ahead of us, the job of rolling out vaccines. It's an unprecedented logistical scale of work that has not been seen in recent times. And with this, the logistics part of it, we can do. It is the hardware part of it that many of us here are trained and have done many times. But the biggest challenge is the hearts and minds. And the hearts and minds really is about the level of misinformation and the conspiracy theories that continue to flow amongst our people. And if the media can help us to really prepare people for receiving the vaccines so that we don't waste time debating a lot of misinformation and conspiracy theories, but we get to the job of fighting the pandemic. I think that's an important thing to look at and to think about. And where I began is where I end. Weeping may endure for the night, but the morning is coming. And I will say again, it may have been a dark 2020, but 2021 is dawn. Thank you very much.
Thank you very much again, Mr. Maposa, with your prophecy and poetic words. So finally to you, Dr. Moeti, but there's a burning question for you that Kara Anna would want you, from the Associated Press, would want you to also mention in your final remarks. Dr. Moeti, has the WHO asked this Biden administration to share United States excess vaccine doses with African countries, and what has been the response?
Okay, thank you. I think that, you know, first of all, the US government was not part of the COVAX initially, so I do not believe that those types of conversations were going on. And so far, the government announced this morning that it was rejoining WHO. I think it's early days for that sort of discussion to happen. I'm certain that in the process of continuing to mobilize donations at the global level, certainly these types of discussions will be taking place. I think just to end as well, I'd like to somewhat follow on what my two co-panelists have said, that, you know, the situation is challenging at the moment, especially as relates to the question of equity, and as we see people on our continent watching people in other places start to get vaccinated. And this can be hurtful, it can engender anger and feelings of being, as usual, left behind. What I would like to say is that first, we are not giving up on global solidarity. We're not giving up on the question of working for this equity in the discussions going on with various countries. And then secondly, let's use this as an opportunity to really strengthen our preparing for when the vaccine arrives, to be ready to deliver really strong campaigns, programs, so that it works well, it works efficiently, and we very quickly roll out the campaigns and cover all the people that we are aiming to cover it at the times that it is planned to do. And then finally, I'd like to add my own voice around the communication by our journalists. So while we continue to deplore and be sorry about the fact that we are behind, please let's not plunge people into a state of despair. This is coming. The delay is a matter of some weeks or months. And if it helps us to be better prepared to roll out strongly, let's prepare people to play their role to receive the vaccine, and most importantly, to continue with those hygiene measures and preventive measures that will continue to be so important for a while. Thank you. And thank you again for having joined us.
Thank you very much. Thank you very much to you, our panelists, and thanks for doing justice to the questions from the journalists. And once again, dear journalists, we thank you for joining us, and we don't take it for granted, and see you next Thursday at the next press briefing. And thank you to Dr. Mihigo for joining us for this press briefing.
Thank you very much.
Thank you. Over and out.